Assalamu alaikum everybody. Bismillah ar-Rahman ar-Rahim. Today's presentation will be about intravenous general anesthetics. And as we have said before, general anesthetics are drugs which are used to produce reversible loss of consciousness, and we classify them into two groups. Inhalation general anesthetic, which we talked about in last two presentations, and intravenous general anesthetics. Therefore, intravenous general anesthetics are drugs which are given through the intravenous route. Either they are used to induce general anesthesia, which is maintained by inhalation general anesthetic, or they can be used alone as general anesthetics, as we will discuss later. Okay? Some of them they have other therapeutic uses. For example, opioids, اللي هم known as morphine-like drugs, they are used as analgesics. And as I have said, we have to differentiate between analgesics and anesthetics. Analgesics are drugs which are used to treat pain, while anesthetics are drugs which are used to prevent pain. Okay? So there is a difference between the clinical application of each. The second groups are the benzodiazepines, and this group of drugs that are used mainly as anxiolytics and sedative hypnotic. Other intravenous general anesthetic includes the barbiturates, which were used some time ago as sedative hypnotic, and they are still have little use in treatment of epilepsy or anticonvulsant. Okay? So what are the main goals of this presentation? What are the main objectives? We are going to discuss the different groups of intravenous general anesthetic. We are going to discuss their pharmacokinetic property and how they differ from each other. And as well, we are going to discuss their pharmacological actions on different organs in the body. We are going to discuss their clinical application, and lastly, their contraindications when they should not be used. Okay? So the general anesthetics, intravenous general anesthetics, they belong to a major group of drugs known as general CNS depressants, general central nervous system depressants. These general central nervous system depressants, they are drugs that can produce dose-dependent depression of the central nervous system, dose-dependent inhibition of the central nervous system. These drugs at small doses, they can produce sedation, what is known as sedation. Sedation means the patient will become calm. Sedation بالعربي معناها التركين. Okay? So in small doses, intravenous general anesthetics or general CNS depressants, they produce sedation. Once I increase the dose, these drugs, they can produce hypnosis. Hypnosis means the person will go into sleep, from which he can be awakened. So hypnosis, النوم النوم, the patient will enter into sleep. Okay, hypnosis. If we still increase the dose more, they can produce a general anesthesia. That means loss of consciousness. If the dose is increased further, this will lead to death due to medullary paralysis. The most of the general CNS depressants in small doses, they can produce sedation. If I increase the dose, they can produce hypnosis, general anesthesia, and finally, most of them, they can produce death due to medullary paralysis. This includes many drugs which we will talk about, inshallah, in the near future. This includes the barbiturates, as I have said, benzodiazepines, opioids, and ethanol. So the intravenous general anesthetic, they are general CNS depressants. They are not specific in their action. They produce dose-dependent depression of the central nervous system. Okay? So the first group we are going to talk about are the ultra-short-acting barbiturates. As we will see later, these barbiturates, they are classified into 4 groups according to duration of action. These ultra-short acting, they are the shortest in their duration of action. They They produce action which lasts only for a few minutes, okay? They are known as ultra-short-acting barbiturates. We have many examples like thiobentone, thiobentone, this is the English name for it, thiobentone. The American name is thiobental, It's still the same. Thiobental is the same as thiobentone. This is the English name and this is the American USA name, okay? The second example is methohexitone, the same thing, methohexitone. In America or in United States or in Canada, it is known as methohexital, methohexital, the same thing. Lastly, thiamylyl, usually it is not used anymore in humans. It is mostly used in veterinary medicine, okay? So these drugs, as I have said, they have very short duration of action, which lasts only 4 minutes. Because first they are distributed to the brain, fast distribution to the brain. Once they are given intravenously, immediately, because they have very high lipid solubility, they immediately enter the brain within seconds, okay? Within 20 or 30 seconds, they enter the brain. They produce the loss of consciousness, and then from the brain, they will be redistributed to other tissues in the body. يحصل لهم redistribution، إعادة توزيع. أولا يدخلوا الدماغ بسرعة. Why؟ لأن they have very high lipid solubility. وبعدين شنو يحصل لهم؟ يحصل لهم redistribution، إعادة توزيع. That's why they have a short duration of action. Okay? واضح؟ Okay? Now, where they are distributed. If they are given in a single dose, they will be redistributed to the skeletal muscle. Because the skeletal muscle, they are highly perfused organs. They have a large blood supply. Okay, first, if they are given in single dose. And after they are distributed to the skeletal muscle, they will be eliminated through hepatic metabolism. Therefore, barbiturates, ultra-short, once they are given, they enter the brain very fast. Why? Because they are highly lipid soluble. Or then they are redistributed to other body organs. A redistribution will terminate their action. The physiological termination of their action is the redistribution from the brain to other tissue. If they are given in single dose, they will be redistributed mostly to the skeletal muscle. And from there, it will be eliminated through hepatic metabolism, through cytochrome B450 enzyme, through oxidation in the liver oxidation, okay? After continuous infusion, they will be redistributed first to the skeletal muscle and then to the adipose tissue, the fat. While adipose tissue, because the blood supply to the adipose tissue is little, okay? And then from there, they will be eliminated through hepatic metabolism. So I repeat that because it is very important. This is all for all general intravenous general anesthetic. They have fast action and short duration. Fast action means they produce action within seconds, and short duration means their action will be terminated within 10 to 15 minutes according to the drug. Okay? Why they have fast action and short duration? Because they enter the brain fast, and then they are redistributed to other body tissue. This will terminate the pharmacological action of the drug. Once it is redistributed, it will be metabolized in the liver by liver microsomal enzymes. So this is the kinetic of the ultra-short barbiturates. What are the pharmacodynamic of these drugs? What they produce in different organs of the body. On the cardiovascular system, as I have said, they are general CNS depressant, so we expect that they will produce inhibition of the vasomotor center in the medulla, or the vasomotor center is responsible for the regulation of the blood vessel. فبالتالي, when vasomotor center is inhibited, in this case, what will happen to the blood vessel? Vasodilatation. As well, they will reduce sympathetic outflow. With sympathetic outflow, as we have said before, from the medulla, they cause vasoconstriction. If this is inhibited, that means it will result in vasodilatation. Of course, the vasodilatation of the resistant blood vessels will result in decrease in arterial blood pressure, decrease in arterial blood pressure. This is the first effect of barbiturates. They will result in a decrease in arterial blood pressure. Why? Is it a direct effect on blood vessel or indirectly through central inhibition? It is indirectly through central inhibition. واضح؟ They inhibit the vasomotor center وsympathetic outflow from the medulla. واضح الكلام؟ As we have said before several times, the decrease in arterial blood pressure through baroreceptor reflex, they produce reflex tachycardia, reflex increase in heart rate. Therefore, barbiturates we expect they will decrease the blood pressure and as well they can produce reflex tachycardia. واضح? Okay, now? Okay, so they increase the heart rate reflexly. Okay, now this effect is okay for a normal person. But in certain clinical condition, it is dangerous. It is dangerous. We have to take care of it. Why? Because in cases of hypovolemia, for example, hypovolemia, what does it mean? معناها decrease in the blood volume. In person who is suffering from hypovolemia, usually his blood pressure is low. As we have said before several times, blood pressure will depend on cardiac output and blood volume. If the blood volume is low, in this case, blood pressure would be low. معناها in this case, if the person suffering from hypovolemia plus the decrease of blood pressure produced by barbiturates, he can enter into shock. Severe drop of blood pressure, which is dangerous. So in this case, we have to take care of this patient. واضح الكلام؟ Second, when we use beta blockers, a patient treated with beta blockers, usually a patient treated with beta blockers, they have low blood pressure. في الحالة هذه, if he has low blood pressure plus the decrease in blood pressure produced by barbiturates, in this case, he might enter into shock. وكذلك في حالات when there is cardiac defects like cardiomyopathy, ولا there is a defect in the valves, cardiac valves. In this case, usually this will result in decrease in cardiac output, and the decrease in cardiac output plus the decrease in arterial blood pressure will result in severe drop of blood pressure. يبدأ this is the first effect on the cardiovascular system. واضح? Okay? يبدأ centrally they inhibit the vasomotor center. This will result in decrease in blood pressure, which will result in reflex tachycardia. This action is most prominent in people who are suffering from hypovolemia, ولا who are treated with beta blockers, ولا people with cardiac defects. Okay? Or respiratory center, the same thing. They will inhibit the respiratory centers in the medulla. What respiratory centers in the medulla, we have said they are control respiration. So they depress the medulla, and this will decrease the tidal volume, and they will decrease the minute volume, and this will result in inhibition of rate of respiration. يبدأ they inhibit the rate of respiration. Therefore, we expect in the barbiturates, they will have centrally, they will depress respiratory center in the medulla, and therefore they will depress respiration, tidal volume, and in minute volume. واضح الكلام? Okay. Also, they will decrease or depress the reflex responses to hypercarbia, and hypoxia. Hypercarbia means an increase in the level of carbon dioxide in the blood. This is hypercarbia. Hypoxia means that there is a decrease in the oxygen supply to the body tissue. In this case, if this happens physiologically, hypercarbia or hypoxia, when this happens physiologically, they will reflexly stimulate the respiratory centers in the medulla to increase the respiratory rate and depth of respiration. ولكن barbiturates, they inhibit that. They decrease the reflex responsible for response to hypercarbia and hypoxia. So what will happen? يحصل gradual increase in carbon dioxide in the blood, أو يحصل gradual hypoxic response in the tissue. وهذه this is dangerous as well. This is a disadvantage of barbiturate. This is not a good thing to happen. So this is disadvantage. They inhibit or decrease the reflex response, hypercarbia, which is an increase in carbon dioxide in the blood, and they decrease the reflex responses to hypoxia. This is dangerous. A third thing, they don't depress noxious airway reflexes. These noxious airway reflexes, this is reflexes which can take place when anything foreign body enters the airways, the respiratory airways, the larynx. Supposing now we want to induce a tube into the larynx. This will result in coughing and will result in laryngospasm, spasm of the larynx, and as well it will result in bronchospasm. This is known as noxious airway reflexes. Noxious airway reflexes. This is not inhibited by barbiturates. بالعكس, they are increased. So this is dangerous sometimes. فلو person is given, for example, a barbiturate, and the surgeon he want to introduce a tracheal tube, the patient might enter into laryngospasm and bronchospasm. So this is a disadvantage of barbiturate, which is different from other intravenous general anesthetics. Okay? يبدأ on respiratory rate, on respiration in general, barbiturates, they have bad effects. All their effect on respiration are not advantages. All of them, they are disadvantages. Okay? On the central nervous system, as I have said, they have a depressant effect on the central nervous system in general. وقلنا this depression is dose dependent according to the dose, starting from the upper cortical area and goes down to the medulla, which can result in medullary depression. So what will happen on the central nervous system? First, that we have to know about that they produce hyperalgesic action. hyperalgesic action. Algesic معناها pain. Algesic معناها pain. This means that they will increase the sensation to pain. Hyperalgesic. We have analgesic. أنا معناها removal. أنا, what does it mean? Analgesic. أنا معناها removal. والجesic معناها pain. Removal of pain. Analgesic. 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 What does it mean? Analgesic. أنا معناها removal of pain. وألجesic معناها pain. معناها removal of pain. That's why they are known as analgesics. In this case, they produce hyperalgesic. They produce barbiturates. They produce hyperalgesic action. Hyperalgesic. معناها they will increase the sensitivity of pain. This is disadvantage. معناها in this case, if we use barbiturates, we have to use other drugs which inhibit pain لأن they will increase the sensation of pain. This is disadvantage. barbiturates وكل الانترافينوس general anesthetic ما عدا واحدة بس, as we will discuss إن شاء الله in few minutes. All of intravenous general anesthetics, they decrease the metabolic need ولا oxygen consumption of the brain. They will decrease the cerebral metabolic oxygen consumption rate. This is advantage. This is advantage because in this case they will prevent cerebral ischemia. They will prevent cerebral ischemia. Ischemia معناها عاوز الأكسجين. Ischemia means, what does it mean? Ischemia معناها عاوز الأكسجين. معناها decrease in blood. معناها decrease in oxygen supply to the brain. This will result in ischemia. Ischemia عاوز. Okay, so in this case, this is a good thing. This is advantage of barbiturate. They decrease cerebral metabolic oxygen consumption. Therefore, they will protect against cerebral ischemia, and oxygen demand will be decreased. So this is an advantage for barbiturate. Okay. Third important function, that they will decrease cerebral blood flow. They will decrease cerebral blood flow, and therefore they will decrease in intracranial pressure. They will decrease in intracranial pressure, and this will add to the advantage of decreasing the oxygen consumption. Okay, so they will protect against cerebral ischemia. Okay, clinical uses of barbiturates, especially thiobentone, it is used for induction of general anesthesia. Induction of general anesthesia, usually they use from 3 to 4 milligram per kilogram. And the thiobentone will produce loss of consciousness very fast within less than half a minute, and their peak effect is 1 minute, and the duration of loss of consciousness will continue from 5 to 8 minutes. Therefore, if the operation is very short, in this case, thiobentone is enough for the surgery. If the operation is longer than that, the general anesthesia is maintained by giving inhalation anesthetics. Okay. Now, this dose should be adjusted in certain cases, like for neonates. They found neonates They found that the neonates, they require high doses of thiobentone, while pregnant women and elderly, old people, they require less dose, okay? And as well, if the patient is pre-treated with drugs which produce CNS depressant, like opioids, like benzodiazepines, like alpha-2 adrenergic agonists, all these drugs, they are CNS depressant. For this case, if they are pre-treated with these drugs, the dose of thiobentone should be reduced because both of them may produce CNS depression if they are given without adjustment of the dose. In this case, thiobentone can produce severe depression of the respiratory and cardiovascular centers. Okay? So these are the clinical uses of barbiturates. There is only one contraindication. There are many, like for intravenous general anesthesia, they should never be given in cases of acute porphyria. People who are suffering from acute, intermittent, or variegate porphyria. In this case, if these people, this is a certain genetic disorder, if barbiturates are given to these people, usually it ends up in acute attack of porphyria. Well, acute attack of porphyria will result in neuronal damage, and this is irreversible. So in this case, barbiturates are contraindicated in people who are suffering from intermittent or variegate porphyria. Intermittent or variegate porphyria, okay? Okay. So this is all about the barbiturates as intravenous general anesthetic. ولكن we are going to talk more about this group of drugs when we talk about the sedative hypnotic group of drugs. Okay. Okay. Next in the list are the opioids or morphine-like drugs. As I have said, opioids, they are analgesics, and the details of this group will be discussed when we talk about the opioid narcotic analgesics. Okay. This includes as general anesthetic, intravenous general anesthetics includes morphine, includes fentanyl, alfentanil. Morphine, the most famous, fentanyl, alfentanil. What's the difference between all these? Morphine, as you know, is a natural alkaloid. These are synthetic, and these are usually they are more potent than morphine, as we will discuss later, inshallah. So these drugs they are mainly used in open heart surgery because they have low effect on cardiovascular system. They are used to induce anesthesia in heart surgery because their effect on cardiovascular system is very low. These drugs usually sometimes they are mixed with other drugs like droperidol, which is a neuroleptic, as we will discuss later. A neuroleptic, which is used in treatment of psychosis, neuroleptics. So morphine is mixed with droperidol to produce what's known as neurolept analgesia. Neurolept analgesia. These two drugs they are given in combination so that they produce a state of very strong sedation. Catatonia means rigidity in the muscle, so that the patient cannot move. They produce very strong amnesia, and the patient after recovery he will not remember what happened to him, and very strong analgesia. And this is a neurolept analgesia. In this case, the patient does not lose his consciousness. The patient is still awake. He can respond to orders. From the surgeon. Okay? هذه يسموها neurolept analgesia. A mixture of droperidol plus morphine. Usually, as I have said, the patient is partially conscious. And he can respond to orders. Okay? Yep, this is only used in cases where operation needs patient to be conscious, وكذلك when we need very strong analgesia. If nitrous oxide is added to this mixture, they give droperidol plus morphine intravenously, and they give nitrous oxide by inhalation, this will result in neurolept anesthesia. وجاية من اسمها neurolept معناها there is neuroleptic droperidol, as I have said, this antipsychotic drug used in treatment of psychosis هنتكلم عليها بالتفصيل بعدين. وكذلك المورفين الانالجيسيك، والنيتروس اوكسيد اللي هو الجاز inhalation general anesthetic. These three drugs, they produce very smooth and very strong loss of consciousness. Okay, so there is catatonia, of course, there is amnesia, there is good analgesia, and there is loss of consciousness. Usually this mixture is used in urolipt anesthesia. This mixture is used when the patient cannot tolerate inhalation, other inhalation general anesthetic, halogenated hydrocarbons. When they are contraindicated in this case, the patient he might be given urolipt anesthesia. Okay, so these are the morphine-like drugs. Inshallah, we'll talk about them in details in the future. They are used for induction of anesthesia, especially in heart surgery. Why? Because they have little effect on cardiovascular system. If morphine is combined with droperidol, this will produce neuroleptic analgesia. The patient is still awake, but there is very strong analgesia, very strong amnesia, and strong sedation. If we add nitrous oxide, the patient will lose consciousness, and in this case we call them neuroleptic anesthesia. زي في حالات اللي when the patient cannot tolerate inhalation anesthetic. Okay. The third group of intravenous general anesthetics are the benzodiazepines. Benzodiazepines. The benzodiazepines as a group, inshallah, we will talk about them when we will talk about anxiolytics and sedative hypnotics. Here, what we should know: the diazepam, lorazepam, and midazolam. Diazepam, lorazepam, midazolam. These drugs, they are used as intravenous general anesthetic. So what will happen in this case? They produce very strong sedation, and the patient will be heavily sedated with amnesia. He will forget what happens to him, and muscle relaxation. There is no loss of consciousness. Whatever the dose of the benzodiazepines alone, they can never produce loss of consciousness, and we will discuss that later, inshallah, why they never produce loss of consciousness. So these cases, they are used in certain operations or certain surgical procedures. For example, midazolam is used, very commonly used as pre-anesthetic medication in pediatric, usually pediatric for young people. Sometimes when before they go into surgery, they go into severe anxiety. So they found that midazolam is very effective in decreasing the anxiety and prepare the patient for general surgery. Also, they are used for induction of general anesthesia. It is used. Midazolam is used for induction of general anesthesia. Different routes are usually actually used, like intranasal, like rectal, and intravenous. Of course, with intravenous they are given in a dose of 0.1 to 0.3 milligram per kilogram. يبدأ midazolam is very effective medication as a pre-anesthetic medication in pediatric, وكذلك for old people in dentistry. وكذلك it is used sometimes for induction of general anesthesia to prepare the patient for inhalation anesthesia. Other examples, diazepam and lorazepam, they are used for minor operations when the conscious is needed, like for endoscopic examination. Most of the endoscopic examination, like a gastroscopy, like a tracheoscopy, whatever, they give the patient diazepam and lorazepam. In this case, the patient will be heavily sedated, and he will lose memory of what happens to him, but he still responds to surgeon orders. Okay. Also, for catheterization, the induction of a catheter into the heart, this is usually done under diazepam or lorazepam. Okay. This is benzodiazepines. They are used in cases where we need strong sedation, amnesia, and muscle relaxation without loss of consciousness, زي pre-anesthetic medication for pediatrics, وكذلك in some minor operation. The details of benzodiazepines, inshallah, we will take when we talk about the anxiolytics. Okay. The fourth drug which we are going to talk about, it is a drug, propofol. Propofol doesn't belong to any group of intravenous general anesthetic. It is a lone drug. Propofol, it is a weak acid usually, and that's why it produces pain at the site of injection, and that's why usually it is given with local anesthetic. Propofol, as we will see later, inshallah, it acts through GABA A receptor, and we have said that the GABA A receptors they are linked to chloride channel, and therefore by activating GABA A receptor, they will increase the entry of chloride into the neuron, and this will produce a state of hyperpolarization, i.e. neuronal inhibition. Propofol usually, as we said about the barbiturates, يحصل له fast distribution to the brain first, and then it will be redistributed from the brain to the other tissue. As I have said before, that most of the intravenous general anesthetic, the termination of their action is through redistribution from the brain to other tissue. So propofol, when it is given intravenously, it will enter the brain very fast and produce loss of consciousness, and then it will be redistributed from the brain to other tissue. Okay, the termination of action is due to redistribution. واضح؟ Then once it is redistributed to other tissue يحصل له very fast hepatic metabolism by phase 2 metabolism اللي هو conjugation and excretion in the kidney, excretion through the kidney. Also it has extrahepatic metabolism, metabolism through other routes other than the liver. Okay, the T-half usually is less than 40 minutes and with very fast recovery. Once we stop the propofol, immediately the person will regain consciousness. Okay, the action of propofol on the cardiovascular system, it will reduce the vascular resistance. They will decrease vascular resistance. This is a direct effect on the blood vessel, and this will result in decrease in the mean arterial blood pressure. Of course, the decrease in mean arterial blood pressure will result in reflex tachycardia. واضح كلام؟ Okay. Now, also propofol, it will reduce the cardiac contractility. It decreases cardiac contractility. طبعا البريلود will be decreased because by peripheral vasodilation البريلود will be decreased. واضح الكلام؟ يبقى second, يبقى it has two direct effects on blood vessel and on the heart. It reduces cardiac contractility, direct effect on the heart. Because of vasodilation, preload to the heart will be decreased. And this cardiac contractility is decreased, والpreload is decreased, معنى cardiac output will be decreased. Cardiac output will be decreased. This is dangerous in people who are suffering from ventricular dysfunction. People who have impaired ventricular function, and already the patient and the low cardiac output. In this case, if I give him propofol, his cardiac output will be decreased more. واضح؟ يعني some patient اللي هم they have impaired معناها dysfunction of the ventricle, يعني the ventricles does not function properly. In this case, what will happen معناها more decrease in cardiac output, which is dangerous. واضح الكلام؟ Okay. يبدأ البروبوفول, it has two effects, direct effect on the blood vessels and on the heart. On blood vessel produce vasodilation, decreasing arterial blood pressure, and this would result in reflex tachycardia, as we have said several times, and they depress the cardiac contractility and the preload. This will result in low cardiac output. This is dangerous in people who are suffering from impaired ventricular function. معناها if the ventricular function is low, in this case propofol should be avoided. Okay, respiratory center, the opposite, can depress medullary ventilatory centers, the same thing like barbiturates, it can depress centrally respiratory center. ولكن what is different propofol from barbiturates, it depresses noxious airway reflexes. Noxious airway reflexes. قلنا noxious airway reflexes takes place أمتى when there is foreign body enters the airways, the respiratory airways. This will result in laryngospasm and bronchospasm. فالبروبوفول, this is a good advantage of propofol, it depresses these noxious airway reflexes. فبالتالي we can very easily introduce a tube into the larynx, or we use laryngeal mask, which is used for inhalation general anesthetic. هذا opposite to the barbiturates as we have said. Okay. You have the second, this is an advantageous effect. The propofol can depress noxious airway reflexes. فبالتالي no laryngospasm and no bronchospasm will take place, and we can easily introduce a tube into the trachea, onto the larynx, or we can easily introduce laryngeal mask. Okay. Third effect on the central nervous system, propofol, like barbiturate, it decreases cerebral oxygen consumption. Decreases cerebral oxygen consumption. This is good, as I have said. It decreases cerebral ischemia. Decreases cerebral ischemia. Like الباربيتوريت حتى هو it decreases cerebral blood flow and intracranial pressure, وبالتالي this is advantages as well because it can decrease the oxygen demand, and this will protect against cerebral ischemia. واضح؟ okay. Propofol, it has anticonvulsant activity like الباربيتوريت. Convulsant activity. يبدو البروبوفول sometimes it is used in cases of status epilepticus when the status epilepticus cannot be stopped by the proper anticonvulsant drugs. Okay. So propofol, it is used clinically for the induction of general anesthesia, and in this case we use from 2 to 2.5 milligram per kilogram. And for infusion, if we want to use a continuous infusion, we can use 10 to 50% of the induction dose given every 5 minutes. This is used for maintenance of general anesthesia, maintenance of loss of consciousness. Okay. Also, it is given in status epilepticus, as I have said, because it has anticonvulsant activity. Status epilepticus, what does it mean? Status epilepticus, what does it mean? It is a continuous attack of epilepsy which can produce damage to the brain. So therefore, in this case, if it is not responding to other drugs, propofol can be used and it can stop status epilepticus. واضح الكلام؟ Also, propofol, it is used in long-term sedation in intensive care unit. When the patient is in intensive care units, sometimes we want the patient to be heavily sedated. So they use propofol by intravenous infusion to produce long-term sedation in patient in intensive care unit. واضح الكلام؟ Okay. Well, contraindication, the only one problem with propofol that in some people, when they are given with continuous infusion, they will result in what's known as propofol infusion syndrome. Propofol infusion syndrome. This is a syndrome when propofol is given by continuous intravenous infusion. What will happen in this case? يحصل severe metabolic acidosis. Severe metabolic acidosis, the pH of the blood will be decreased. يحصل rhabdomyolysis, damage to the skeletal muscles. Rhabdomyolysis, معناها skeletal muscle will be damaged, and this will result in release of the myoglobin into the blood. And myoglobin is very dangerous to the kidney because it will be released, it will be excreted through the kidney and can produce acute renal failure. Also, this will result in acute renal failure and cardiac failure. This is the propofol infusion syndrome. This is very rare, ولكن it is very dangerous. So it takes place after long-term infusion. In this case, there is a guideline. They said that propofol should never be given above the 4.8 milligram per kilogram per hour. So this is a guideline for using propofol. They said that it should never be given in a dose over 4.8 milligram per kilogram per hour. If we need long-term infusion propofol, we should not exceed this dose to avoid propofol infusion syndrome. If the propofol is very good intravenous general anesthetic, it is used for induction of anesthesia and as well for treatment of status epilepticus. The only problem, if it is used in high dose and continuous infusion, it can produce propofol infusion syndrome, which is rare but fatal. We should avoid that by giving propofol in a dose less than 4.8 milligram per kilogram per hour. Okay? Okay? So the next intravenous general anesthetic we are going to talk about is the etomidate. Etomidate. Etomidate is an ester, as you will see, and mostly it is present as non-ionized at physiological pH. It has high plasma protein binding. Etomidate, like propofol, it acts through the GABA A receptor, i.e., it produces hyperpolarization of neurons and therefore inhibition. Etomidate, like other intravenous general anesthetic, once it is given intravenously, it will be distributed first to the brain, where it will produce loss of consciousness, and then it will be redistributed from the brain to other tissue. Once it is redistributed, it will be hydrolyzed by plasma esterases because it is an ester. It will be hydrolyzed by plasma esterases, and what is left is metabolized through the liver. يحصل لها hepatic metabolism. Okay. Etomidate, it is characterized on cardiovascular system. It has very little effect on the cardiovascular system, either on the blood vessels. It does not change the vascular resistance. وكذلك it does not affect the myocardial contractility or the heart rate. This is very good advantages effect of etomidate. وكذلك on the respiratory system, it does not depress the respiratory system, does not depress respiration, as we have said for the barbiturates. On the central nervous system, it has a similar action to barbiturate, decreases cerebral oxygen demand. Therefore, it can protect the brain against ischemia. Also, it can decrease the cerebral blood flow and intracranial pressure. Also, it can increase cerebral perfusion pressure. The cerebral perfusion pressure is well maintained. Why? Because it does not depress the cardiovascular system. The cardiac output is maintained, and this maintenance of cardiac output will maintain very good perfusion to the brain. Okay, well, this is an advantages of etomidate. However, etomidate, it has a toxicity. It is metabolized by beta hydroxylase enzyme in the cytochrome B450 in the liver, and this metabolism will result in inhibition of the steroid formation, معناها it produce inhibition of the adrenocortical function. It produce depression of the adrenocortical function. This usually takes place after long-term infusion. Etomidate, when it is metabolized in the liver, it is metabolized by beta hydroxylase enzyme in the liver, and the metabolite will inhibit steroid formation. Well, inhibition of steroid formation will result in the adrenocortical suppression. Well, adrenocortical suppression, as we know, the adrenal cortex is very essential for life. Depression of the adrenal cortex will result in severe consequences. That's why it is rare, but happens. Okay, that's why the clinical use of etomidate is fallen out favor because of this effect on the adrenocortical suppression. It is fallen out of favor as bolus injection for induction of general anesthesia. In this case, the dose is from 0.2 to 0.6 milligram, and this is usually used in cases of hypovolemia and cardiomyopathy or cardiovascular diseases. Now we have said the barbiturates, they will affect the cardiac function, and therefore they should be avoided in these cases. لكن etomidate does not affect the cardiac function, it is very, very useful for induction of anesthesia in patients who are suffering from hypovolemia, cardiomyopathy, or cerebrovascular diseases. Etomidate as well, it was used one time ago as in sedation intensive care units, but now its use is very limited. لأن in this case, in long-term sedation for the intensive care unit, we have to give it for a long period of time by intravenous infusion, so the possibility of adrenocortical suppression will be increased, and this is dangerous, of course, as you know, because the adrenal cortex is essential for life. Okay, because it produces cortisone, and you know cortisone is essential for life. واضح الكلام؟ يبقى الايتوميدate it's out of favor nowadays, although it is still used clinically in some countries. It's still used, especially أمتى when their patient is suffering from hypovolemia or cardiac diseases, because etomidate does not affect cardiac functions. واضح الكلام؟ The next anesthetic we are going to discuss inshallah is ketamine. Ketamine. Ketamine is well known in producing what's known as dissociative anesthesia. Dissociative anesthesia. What does it mean, dissociative anesthesia? Means the person is dissociated from his environment. ولكن الpatient is awake. There is no loss of consciousness, i.e. there is an open eye, the eyelid is opened, there is a swallowing response is there, a muscle contraction is there, but the patient is unresponsive to pain. Patient, there is a very strong analgesia and the patient is unresponsive to pain. Ketamine is one of the antagonists of the NMDA receptor, والNMDA receptors قلنا NAMDA قلنا this is one type of the glutamate receptor. والglutamates قلنا they are excitatory in the brain. They increase the levels of calcium in the brain, and therefore by antagonizing this receptor, ketamine will produce CNS depression. Ketamine belongs to the phencyclidine. Phencyclidine, they are group to which lysergic acid diethylamide, which is known as LSD, belongs. And therefore, we will expect that ketamine will have some of the property of LSD. Mostly it is ionized at physiological pH and it has very low plasma protein binding. Pharmacologically or pharmacodynamically, these drugs, as I have said, it has, like other intravenous general anesthetic, vast distribution to the brain once it is given intravenously, and then it will be redistributed from the brain to other tissues. So it is a rule. All intravenous general anesthetic, they have very quick onset of action. Why? Because they are distributed directly to the brain. And then they have short duration of action. Why? Because they are redistributed from the brain to other tissue. When it is redistributed, it will be metabolized in the liver by hepatic metabolism to less active norketamine. Okay? So ketamine, it will be distributed first to the brain and then redistributed to the other. So on the cardiovascular system, ketamine is well known to increase sympathetic outflow. Sympathetic outflow. Well, sympathetic, as you know, is excitatory to the heart and blood vessel. So what will happen if sympathetic outflow to the heart is increased? Two things will happen. Heart rate will be increased because sympathetic activity to the heart, beta 1, accelerate the heart, and this will result in tachycardia, and it will increase the cardiac output. The cardiac output will be increased. Both the tachycardia and cardiac output will be increased. That means the oxygen demand by the heart will be increased. Therefore, ketamine will increase the oxygen demand by the heart. Somebody will ask you why? Why? Because they will increase the sympathetic outflow to the heart, and this will result in tachycardia and increase the cardiac output. In this case, the work of the heart will be increased, and oxygen demand will be increased. That's why if the oxygen demand is increased, this is dangerous in people who are already suffering from low oxygen supply, like ischemic heart disease. If the patient is suffering from ischemic heart disease, in this case, what will happen? The oxygen demand will be increased by ketamine, and this will increase ischemia. This is dangerous. This is dangerous. So if somebody asks you why ketamine should be avoided in patients with ischemic heart disease, because ketamine will increase the sympathetic outflow to the heart, increasing the heart rate, and as well it will increase the cardiac output. In this case, oxygen demand will be increased, and if there is a decrease in oxygen supply, this will result in more ischemia of the heart muscle. This is very dangerous. This can kill the patient. So ketamine should be avoided in cases of ischemic heart diseases. Okay. Also, by acting on the blood vessel, ketamine produces vasoconstriction. by acting because they increase sympathetic outflow to the heart and to the blood vessel as well. So what will happen in this case؟ يحصل increase in main arterial blood pressure. في الحالة هذه الكيتامين should be avoided in people suffering from hypertension. Of course, if the person is suffering from hypertension, we give him ketamine, his blood pressure will be worse. Okay? واضح؟ يبدأ الكيتامين should be avoided in people suffering from ischemic heart disease or people suffering from hypertension. This is very common question which is usually found in exams. Okay? On the respiratory system, ketamine, it has advantage of not producing depression of respiration. This is very good advantage of ketamine. It can also produce bronchodilation, which is good as well. However, it preserves the upper airway reflexes. يعني reflexes, upper airway reflexes to foreign body is there. It can produce laryngospasm, This is disadvantage of ketamine. On the central nervous system, ketamine, opposite to other intravenous general anesthetic, exactly the opposite. It can increase the cerebral metabolic oxygen consumption. It can increase oxygen consumption by the brain. Also, it increases cerebral blood flow and it increases intracranial pressure. في الحالة هذه معناها it cannot protect البرين from ischemia. بالعكس, it will increase the chance of cerebral ischemia. Should be avoided. يبقى الكيتامين it can increase the oxygen consumption by the brain and it can increase the cerebral blood flow and the intracranial pressure and therefore will expose the brain to ischemia. Contrary to others, it has very strong analgesic effect, very strong, which is equivalent to opioid, like opioid. That's why this strong analgesia, it is used in certain cases as we'll see later. After recovery from anesthesia, many patients, they will recover in unpleasant dreams, hallucination, and delirium. This resembles the LSD effect, lysergic acid diethylamide effect, because as I have said, ketamine belongs to the phencyclidine group, and therefore after recovery from anesthesia, the patient might recover with unpleasant dreams, hallucinations, and delirium. Okay, this can be minimized by co-administration of benzodiazepines. So they give benzodiazepines if the person is going to be given ketamine. They give him pre-anesthetic medication with benzodiazepine. Benzodiazepine will decrease the chance of bad recovery of unpleasant dreams, hallucination, and delirium. Toxicity up to now, ketamine is not known to produce any toxicity, but in animal experiment, they proved that ketamine produces apoptosis or death of the neuron. apoptosis اللي هو mechanisms responsible for the death of the neuron. Usually they found that ketamine, it stimulates apoptosis, especially for young animals. The effect in humans still under study. There is no proof that it can produce this effect in neonates or young people. Okay? The clinical uses of ketamine, it is used for induction of general anesthesia, especially when strong analgesia is needed. As we said, it has very strong analgesia, especially like in burns. When the person is exposed to secondary or third degree burns. In this case, they give him ketamine because it can produce very strong analgesia. The dose usually is from 0.5 to 1 milligram per kilogram. Also, it is used in changing dressings in burns. So, in summary, what we talked about, intravenous general anesthetic, like barbiturate, like propofol, like etomidate, and ketamine. The first three, اللي هم barbiturates, propofol, etomidate, they act through the GABA A receptor, and we have said the GABA A receptors that are linked to chloride channel, and this will result in neuronal inhibition. The ketamine, it acts through the glutamate receptor, It is a glutamate receptor, NMDA receptor antagonist, and this will result in neuronal inhibition. On cardiovascular system, we said both the barbiturate and propofol, they are depressant to the cardiac activity, while etomidate, it has no effect, while ketamine, it increases the sympathetic outflow, معناها it increases the blood pressure, it increases the cardiac output, and it will increase the oxygen demand. On the respiratory system, قلنا the first two, they inhibit the barbiturate and propofol, they inhibit the respiratory centers. The most important that in barbiturates, they don't depress the airway reflexes, this is dangerous. It can produce laryngospasm and bronchospasm. Opposite, propofol, it depress noxious airway reflexes. فبالتالي we can induce endotracheal tube very easily. Etomidate, it has no effect on the respiratory center. Ketamine, it has no effect on the respiratory center. Opposite, they can produce bronchodilation. ولكن like barbiturates, does not depress the airway reflexes. This is a disadvantage. On the central nervous system, barbiturates, they are hyperalgesic. The ketamine, it is produce strong analgesia. Opposite, the others, they have no effect. They are not either hyperalgesic or analgesic. If the barbiturates are hyperalgesic, with ketamine, they are strong analgesic. Okay? The barbiturates, they decrease cerebral blood flow, they decrease the intracranial pressure. The same thing with propofol and etomidate. This is advantage because it can protect the cortex, cerebral cortex, from ischemia. The opposite with ketamine, it increases cerebral blood flow with intracranial pressure, معناها it will increase a chance of cerebral ischemia. Okay? Toxicity, we said about barbiturates should not be given to people who are suffering from porphyria because it can lead to acute attack of porphyria, and this is very dangerous. It can lead to neurodegeneration. Propofol, on the other hand, if it is given in high doses for a long period of time, can produce very rare propofol infusion syndrome, and this is very fatal and dangerous. Etomidate can produce adrenocortical suppression if it is given for continuous infusion and should be avoided in certain conditions. Ketamine, and some people, they recover with unpleasant dreams and hallucination. Mana recovery will not be smooth, and this can be avoided by giving pre-treatment with benzodiazepines. Okay? So this is all about intravenous general anesthetic. At the end, we will say, لله الحمد من قبل ومن بعد. Our next presentation, inshallah, will be about local anesthetic. I would like to thank you very much for your attention, for staying with me to the end of the lecture, and I hope to see you again in my next presentation. Wassalamu alaikum wa rahmatullah wa barakatuh. الحمد لله رب العالمين. شكرا لكم على حسن الاستماع. الرجاء لا تنسوا الاشتراك في القناة، الإعجاب، التعليق والمشاركة مع الزملاء. دمتم بخير وعافية، والسلام عليكم ورحمة الله.